How are you?
I'm good. How are you?
I'm good. My name is Maddie. I'm going to be your occupational therapy student today. There's a few vision screens that I'd like to do with you just because I was reading over your file and it was saying that you've been having some headaches and some blurry vision and some things like that. So these will just be really quick and really functional, and hopefully we can kind of isolate what's going on. Is that okay?
Yeah, that sounds good.
All right. Are you having any issues seeing clearly while you're walking? Do you feel like you need to hold on to things, or you're like bumping into things?
Yeah, when I walk around, I have noticed that I can't see quite as well as I used to, so I sort of kind of learned to get around by touching the objects I know are around my house, my furniture, my couch.
Okay.
It makes me a little bit unsteady.
And do you notice that if you like turn quickly, do you feel like it makes you dizzy, like if you move your head quickly? Or are you having any dizziness anymore?
Yeah, I do get a little bit of dizziness, especially first thing in the morning, and I haven't been moving that much anyways.
Okay. So we're just going to do a quick lap around the gym, if that's okay with you.
Mm-hmm.
Okay. Come up this way. All right. So while we're walking, I'm going to ask, do you see any exit signs?
No, not the usual exit signs I see.
Okay. What about any clocks? Do you see any clocks?
No. No clock.
Okay, not a problem. You can go back to your seat. Are you okay? Are you feeling a little unsteady? Okay, I'll be back to your seat. Okay, so I'm going to do a quick test of your pupils and just see how they react to light. You probably had this if you've ever been to an eye doctor or anything like that.
Mm-hmm.
So just look right at my nose. It might be a little uncomfortable at first. Okay. Good job. Now, can you read this small print at the bottom of my name tag?
It's a little blurry, but it looks like it says student.
Okay, good job. And now I know it's a little hard to see, but can you see any of the words on the whiteboard?
I can see that there's a couple circles on there, but it's hard for me to make out the different words.
Okay, no problem. Are you having any double vision?
Yeah, sometimes I actually am. I notice that things that are close by, like sometimes I'll see two of like a pen or something like that, but it's not always there. Kind
Okay.
of goes in and out.
And when you're having double vision, are the objects really close together? Are they really spaced apart?
They're close together. Like
Okay.
it's normally within an inch or two of one another.
Okay. And now we're going to check something to kind of check the vision in your periphery.
Mhm.
So I'm going to ask you to look right at my nose and then just mirror what I'm doing. So if you can cover that eye. And I'm going to bring this into your field of vision and just tell me when you see it, okay?
Okay. I see it. I see it. I see it. I see it.
Okay. Thank you. And we're going to go ahead and do the same thing to the other eye. All right. Can you just look at my nose?
I see it. I see it. I see it. And I see it.
Okay, good job. Thank you. So we're going to do another thing, just try to get you to look back and forth between two objects. So orange highlighter and a green pen.
Mm-hmm.
So I'm just going to say pen, highlighter, back and forth. And I just want you to look with just your eyes as quickly as you can, okay?
Mm-hmm.
All right, highlighter, pen, highlighter, pen, highlighter, pen, highlighter, pen. Okay, good job. And now we're going to do the same type of thing, but we're going to change the depth a little bit. So I'm going to ask you to just kind of go back and forth say about here. And then I'm going to put this right about 12 inches in front of your nose. So highlighter, and then cup. Highlighter, cup. Highlighter, cup. Highlighter, cup. And one more time, highlighter, and cup. Did you have any blurriness, any difficulty kind of like switching back and forth from looking at something close to far away?
Mm-hmm. It was a strain on my eyes, and both of them were very blurry when I was switching from one to the other.
Okay, no problem. We're gonna do a couple other little things. I'm just gonna check the range of motion in your eyes. So again, I'm gonna ask you to follow the pen. Okay, and now a different pattern. Good job, almost done. Okay, thank you. All right, one more thing with the pen. I'm going to bring it close to your nose, and then I just want you to keep your head steady and follow it with your eyes. I'm going to get to where it's like touching your nose, but if you can't follow it, that's okay. Just let me know when you need me to stop, okay?
Okay. Stop right there. That's hurting.
Okay, no problem. All right, the last thing I'm going to do is I have some X's drawn on this piece of paper. And I'm just going to ask if you can recreate that on this piece of paper. Just pay attention to the size and the alignment of all the X's if you can.
Okay. This is kind of tricky.
It is. There's a lot of X's on there.
Okay. I think I did it.
Okay, it looks great. Thank you. So I did notice that you've got some deficits in certain areas. I wanted to talk to you about a few things that you can do at home to kind of work on these things. First, your vision acuity, which means like your ability to see words close up or from far away, isn't something that we can really work on in OT just because I can't prescribe you glasses. I noticed in your chart it's been a while since you've had your eyes checked, so I'm going to write down a local ophthalmologist and just refer you to him because I think that could help a lot of the problems that you're experiencing.
Yeah, I haven't seen him in a while.
Oh, good. So you're due for a checkup anyways. That'll be perfect. Also, just when you're in your house, walking around, just kind of be aware of light because glare can cause a lot of vision issues. You want to make sure you're scanning rooms when you're walking in because since you're having some mobility issues, I don't want you to fall or have balance troubles. So one technique that works really well is finding one corner and then finding the other corner and practicing scanning along the floor for any obstacles or anything that you may find before moving forward. As far as your ability to track an item, follow the pen smoothly. Doing something like a puzzle on a table will give you the opportunity to kind of scan items and practice with that. Crossword puzzles. Yeah, and it's something you can do, seated at the end of the night. It's a nice relaxing activity you and your husband can do together. Crossword puzzles are really good because you get the black and white contrast and you have to scan back and forth. And the shifting from near and far. So with both of those things, I want you to really practice throughout your day, focusing on an item when you're having that double vision. So for instance, in the morning, if you're sitting at the table, eating your breakfast and it's a little blurry, really focus on it. You've got to retrain your eyes to learn to focus. So until that's clear, and then maybe shift up and look at the TV that's further away. Or, pick a spot if you have a coffee machine on the other side of the kitchen or something like that, and then really focus on that until it's clear and kind of practice that shifting between near and far. and that'll help with your ability to kind of see different distances as well as hopefully the double vision. So do you have any questions?
That sounds like really easy stuff that I can implement. So
Okay.
I'll definitely do it.
Awesome. I think it'll really help, and I'll grab the referral information for that ophthalmologist.